Welcome to this explainer. Look, if you're tuning in today, chances are you, or maybe someone you know, has been endlessly searching for answers to a really deeply personal and honestly super frustrating kind of pain. Well, today, we're taking a compassionate, clear-eyed look at one of the absolute most underdiagnosed conditions in women's sexual health, clitoral adhesions. Let's pause right here for a second and just read this. Pelvic pain is real, it is not in your head, and there are evidence-based treatments that help. I want to emphasize this because, so many women spend literally years, sometimes decades, being completely brushed off by the medical system. Maybe you've been told your pain is normal or just part of being a woman. Well, actually, scratch that, it isn't. Your experience is totally valid, and as we're going to see, there's a very clear anatomical reason behind it.
Okay, get ready for this number because it blew my mind. 22%. That is the percentage of women seeking help for sexual dysfunction who are actually dealing with clitoral adhesions. And get this, they're found in up to 33% of female college students during routine pelvic exams. So this isn't rare at all, it's just rarely talked about. And sadly, it's pretty rarely checked for by general doctors.
So, what exactly is happening under the hood? Literally. Well, a clitoral adhesion, which doctors sometimes call clitoral phimosis, happens when the clitoral hood becomes fused, or essentially stuck, to the glans clitoris. Normally, this hood retracts super freely, but when it's fused, it just can't. The most crucial takeaway here is that this is a recognized, mechanical, physical issue. It's a structural roadblock in your anatomy, absolutely not some psychological hurdle. Think about the contrast here. It's pretty striking. In a healthy state, the hood moves around freely, allowing for natural stimulation and then sliding back to protect the glands. But with an adhesion, because it's completely fused down, debris naturally just gets trapped underneath. Over time, things like smegma can actually harden into what are called keratin pearls. Imagine tiny, hard, sand-like granules trapped right against literally the most sensitive erogenous zone on the human body. As you can guess, it causes severe irritation, ongoing inflammation, and can restrict sensation entirely.
Moving on to section 2, what you might feel, recognizing the symptoms. If you've been dealing with mysterious pelvic or vulvar discomfort, listen up, because these are the exact clinical symptoms patients describe. You might feel clitoridemia, which is like a persistent burning, aching, or stabbing pain. Or for some people, it's the total opposite, just numbness, where things don't feel like they used to at all. Others get this intense hypersensitivity, where even just the light touch of your underwear is completely unbearable. It can also lead to muted orgasms, not being able to orgasm at all, or lingering pain during and after sex. If this sounds familiar, this is what's actually happening in your body.
Next up, why it happens, uncovering the root causes.
The triggers for this are kind of all over the map, but it's never random. It can kick off with that smegma and keratin pearl buildup we just talked about, but it's also really frequently linked to inflammatory skin conditions, like lichen sclerosis or lichen planus, which make the tissue thin out and super prone to scarring. Hormones are a massive factor too. Drops in estrogen during menopause or postpartum thin the tissue and zap its elasticity. Even physical trauma, like past surgeries, childbirth injuries, or just chronic irritation from tight clothing, can trigger this fusing process over time. Now here is where things get really fascinating. This is the missing link that recent medical research has highlighted: clitoral pain and the pelvic floor. You see, clitoral adhesions rarely, if ever, just exist in a vacuum. They almost always trigger broader issues, specifically pelvic floor muscle dysfunction. Think about this for a second. When the body is in persistent pain, it protects itself by tightening the surrounding muscles. It makes total sense, right? Think of your pelvic floor like a flinching muscle trying to guard a physical wound. If you have chronic clitoral pain, your pelvic floor muscles are automatically going to tense up to guard that highly sensitive area. And over time, this protective tension turns into an involuntary loop. Your muscles just stay locked tight, creating this brutal cycle of increased sensitivity, restricted movement, and ultimately even more pain. And because of this shared muscle tension and nerve sensitization, clitoral adhesions frequently show up alongside a whole network of complex pelvic pain conditions. We're talking about things like vulvodynia, provoked vestibulodynia, pudendal neuralgia, interstitial cystitis, and dysorgasmia, which is painful orgasm. So if you've been handed any of these diagnoses but you still have unexplained clitoral pain, an adhesion might literally be the missing piece of your puzzle.
All right, let's talk solutions, the journey to recovery, treatment, and lasting relief. I really want to offer a strong message of hope right now. This is highly treatable. It's not just wishful thinking, it's a structured, proven process.
The initial medical steps usually involve a provider addressing the fused tissue directly. For mild to moderate cases, they might do non-surgical lysis, which is a gentle manual separation of the hood right there in the office with a topical anesthetic. They might also prescribe topical therapies like estrogen to plump up thinning tissue or corticosteroids to calm down inflammation. And for really severe, stubborn cases, surgical adhesiolysis under anesthesia is always an option. But, and this is a completely, absolutely crucial but, treating the adhesion itself is only part of the picture. Getting the tissue physically separated just isn't enough on its own to cure the pain. Remember that cycle of muscle guarding we talked about earlier? Yeah, you have to resolve those years of protective pelvic tension and that massive nervous system freakout. Otherwise, the pain loop is basically just stuck on repeat, even after the adhesion is gone. This is exactly where specialized pelvic floor physiotherapy swoops in to finish the job. It's a super precise approach. Step 1 is clitoral prepuse myofascial release, or MFR. It's a general hands-on technique by a trained physio to restore your natural tissue mobility without needing more surgery. Step 2 focuses on retraining those locked-up pelvic floor muscles to finally just let go of their guarding. And Step 3 is all about nervous system regulation, actively teaching your brain to dial down those loud pain signals so your body can feel safe again. To really empower this retraining, specialists use something called biofeedback. This is so cool. It's real-time visual technology that shows you exactly how your pelvic floor muscles are activating and relaxing. By combining this visual data with breathing exercises, you can literally see your involuntary muscle guarding on a screen right in front of you and consciously learn how to release it. It takes all the guesswork away and puts the control right back where it belongs, in your hands. Now, to tackle this effectively, you really need a team that specializes in complex pain, not just your run-of-the-mill general physio. Ova Women's Health Clinic, based in Burnaby, are internationally trained specialists in exactly this kind of stuff. They provide whole-person, trauma-informed care. With over 2,000 successfully treated complex pelvic pain cases, they have the deep expertise in clitoral and vulvar conditions that is honestly almost always missing in general healthcare. They believe you, they will absolutely not dismiss you, and they know exactly how to treat the whole picture. So if anything we've covered today is resonating with you, I highly urge you to take action. You've been patient for way too long. Just scan the QR code to book your unhurried, entirely confidential, and completely judgment-free consultation with Ova Women's Health. Specialist help really does exist, and it starts with just one simple appointment. I'm going to leave you with this final thought. If a totally structural, highly treatable condition has been hiding beneath years of unexplained pain, what would your life look like if you finally unlocked it? You deserve answers, for sure, and true healing is entirely within your reach. Thank you so much for hanging out and learning with me today, and take care of yourselves.